great to see so many of you all here today. So I'm Adam Graham. I run BD Matters. And I guess for those of you who don't know much about BD Matters, we're a like-minded community of business development enthusiasts, but we welcome entrepreneurs, procurement professionals, sales and marketing people. So it's a great community. And every month, at the beginning of every month, every Wednesday, we do an interview with an industry expert. And so that's what we're going to be doing today. Today, we're going to have a compelling conversation around the pharma industry. And we are joined by a couple of great people who I'll let them introduce themselves shortly. But we've got Malik Akhtar, who's Vice Head of Procurement for Consumer Health Product Supply. Philip Schuster, who's Agency and Marketing Partnerships Director for Global Strategic Marketing on the Consumer Health side. Was the longest job titles. Thanks, guys. And Chris Jones, who is CEO of Space and Time. And I'm just going to pop a link in the chat, because if any of you want to add these events to your diary on a regular basis, if you use that link, that'll put that in your diary, and then you could join any future months. As I say, it's the first Wednesday of every month at 12, which is Greenwich Mean Time. Cool. So I'm just going to pin the other guys and bring them into the conversation. So Philip, do you want to shoot first with a very quick intro on who you are?
Yeah, thank you, Adam, and thanks for having me today. So my name is Philip. As I will not repeat the long job title, but what I basically do, I look after agencies and also non-agency partners here in consumer health at Bayer. So important is that this is the consumer division, so the OTC division, so not the RX division. So I've been doing this for the last 3 years. Previously, I was actually in the same team as Malik. I was in marketing procurement and did a category management role in marketing procurement for Bayer. Prior to that, I was in Adidas for 6 years. I was agency side as well for a bit, so I have seen that, and I was in the marketing of Puma at the beginning of my career. So I came into this industry not at the beginning, a little bit later. But yeah, I've enjoyed it ever since. So yeah, and thank you for having me.
Great, thanks for Malik. Do you want to go next?
Perfect. So thank you. Thanks for the invite, Adam, and great to see. I think some familiar faces and names. My name is Malik Akhtar. I spent a long time in marketing procurement, first at GSK and more recently at Bayer. I've now moved on from marketing procurement. I didn't think this day would come, but I'm now back where I started in supply chain. So, rejoining supply chain 18 months ago, just as the world was falling apart, was maybe not the best career decision, but, we made our bed, we have to lie in it. I've, worked across, pharmaceuticals, some of our animal health, and more recently, the consumer health portfolio that we have. And very excited to be here, and especially when procurement are introduced as professionals at the beginning of the session, that you're in a good place. So looking forward to the discussion.
Yes, always welcome here. Chris, do you want to go next?
Great stuff. Yeah, thank you. So I am Chris Jones. I'm CEO at Space and Time. Lovely to meet you. I think there are some familiar names on here, but for those of you that don't know us, we are a growth marketing agency and specialist. We primarily deliver products across media, technology, production, training, kind of a list as long as your arm, really. Mainly kind of trying to offer solutions to brands that are looking to grow and have a really sort of customer-centric proposition and objective to solve, because we kind of set our stall out as giving brands the ability to be able to interact with every part of the customer experience. And I think kind of our involvement up to now has been, we're working with a number of kind of pharma and healthcare brands, and I'm kind of really keen to hear more from Malik and Philip, but also hopefully to be able to share some useful insights from our own experience. And I guess primarily I want to know how Philip ended up from Puma all the way to Bayer. I think that's probably the most interesting insight I'm keen to know. So yeah, that's us.
Cool. Right. Well, I think that's it. Should we get started? Chris, you want to start leading the way on we're going to get into some of the pharma trends and find out what's going on in the industry. So I'll hand over to you.
Yeah, cool. Thank you. I guess the first place to start is we wanted to kind of look at the industry as a whole, really. And I think obviously talking before, we mentioned pharma and big pharma, and I think it's probably quite key to disclose from the outset that obviously you guys are a life sciences business, right? And you know, rather than a big pharma business. But I think there's obviously a lot happening in big pharma at the minute, and I guess we just wanted to understand what you guys feel are the kind of key challenges that are facing not just big pharma brands, but pharma brands generally going into this year. Perhaps we start with Malik there. You've unmuted.
So I think there's a couple of things which are maybe not necessarily specific to pharma, but I think it's challenges that we're all facing is around talent. So we have, and I'm sure you've read, just in terms of the numbers of people, a lot of our peers and competitors are making a number of people redundant. You know, I mean, we see it in tech, but we also see it in pharma. Where I'm based in Switzerland, there are currently a lot of people in the market. So whatever we do, we need to do it with fewer people. This seems to be disproportionately affecting our traditional sales force and sales representatives. So maybe when we think about some of the trends, will be how we switch from face-to-face more to the virtual detailing, which I know is not a new trend, but obviously, you know, the necessities of the resource that we have means it's more important than ever.
Okay, Philip, did you have anything to add on that point?
Well, I would say for me, of course, I look at it more from a marketing angle. And you know, with the discussions we had at the beginning of the year, you know, okay, so what is the big challenge of the year? Is like we now have to get to grip with the post-COVID reality, right? So while we were in COVID, you know, admittingly, maybe not to a surprise, you know, our business was actually doing quite well now, specifically the consumer health business. And so we had really, I think, a good couple of years. Now, in that post-COVID situation where maybe, you know, things are changing. Of course, there is a certain momentum we have as a healthcare industry overall. As you know, people are maybe more aware and more concerned about their health, and hopefully also more proactive about their health, which is also especially what we as a consumer health business are here to support. But then we also are, you know, in a cost of living crisis, not only in Europe or here in the UK, but you know, across the world. We have inflation. You know, dispensable income is going down. So these are challenges we as a business do also feel, maybe in some categories more than in others, and I think everybody feels that. And you know, we have to find our way and our solutions, you know, to address those challenges.
So I guess there's one sort of, I guess, quite consistent theme, particularly in what Malik said, is that, and I guess what I'm keen to know is that where there's a theme there around obviously looking to work smarter, work more efficiently as a business. Do you feel that that mindset, that ethos is kind of cascading into marketing? Is that kind of same requirement set out there from within the marketing teams, and I guess as a knock-on effect to that, the agencies that work with you?
Well, I mean, I would say from my perspective, I always felt that there was this drive for efficiency in marketing. From day one, I joined Bayer, and I joined this industry. As you mentioned, I was in sports before, and you know, it was a bit of a different mindset there. I mean, it was you know, there was maybe not that drive for efficiency there as it is in the healthcare industry. I think what the challenge is for the healthcare industry is, and that's also something we have been advocating, and especially our global CMO, Patricia Corsi, who is an amazing leader, by the way, and I enjoy really working for her, is about we need to actually bring in more creativity, right? And maybe there's also creative solutions to be more efficient, right? and that's something maybe also this year is a key theme, right? So how can we be more creative? How can we be more emotional? How can we be also more bespoke and more personal, but still be efficient? And I know that's a lot to ask. That's basically everything, but honestly, these are the challenges we have to face, and we have to find solutions for it. And that's what basically, I try to help personally with, the agencies we have, and with also potential new partners we are working with.
Yeah, because I mean, I didn't realize we'd be drawing parallels between Puma and Bayer, but I do think there's an interesting thing to take out there, because as you say, there's probably a little bit the creativity and the kind of relatability and emotional part of what we're trying to do is I think naturally really important, particularly, Philip, within your role being more OTC consumer facing, right, with what you're doing within the marketing team. Do you how reliant are you, and I guess how much potential do you see in the future, primarily this year, in the use of data to enable some of that creativity and the use of more relatable advertising and consumer facing marketing?
I mean, data is absolutely critical, right? And we have, I mean, that's maybe the biggest game changer in marketing over the last, 10, 15 years, that, we have an abundance of data, which we didn't have. I think, marketing in the past was, in a lot of cases, at least at the outset, a bit of a guessing game. We believe that this works, and, we only know, I don't know, months after maybe, or at least, quite some time after, if it did. Today, we basically know it instantly or fairly quickly. On the other side, we also have to be careful that we do not become slaves to data, and don't just, that we also measure the right data in the right way, because, sometimes, you can't see the forest, trees, right? And then, it becomes distracting. And I also feel that sometimes, especially when it comes to creativity, we have to, we also have to trust and to believe that an idea is good, and then we have to run with it. And for example, in our case, Patricia has started this initiative called Creative Unleashed, where we basically give agencies the opportunity, our closest partners, to just be creative on our brands. And we don't really give them a brief. It's pretty much a non-brief brief. And because they know us, they can then really come up with quite exciting ideas and solutions for our brands. And then Patricia will award the best ideas to be executed. And for example, for those ideas, we don't test them, right? We literally we believe in them, and we put them into market. And these ideas are, quite successful. And that's also where, we need to inspire. We want to use things like this to inspire the industry and our teams to be more creative, to try things out, to do things maybe differently, to be very emotional, very empathetic. And I think that will be critical for healthcare marketing over the next few years.
Absolutely, yeah. And I'm just keen to bring Malik into this as well, and I appreciate, Malik, again, you've obviously relatively recently moved away from the marketing side, but I guess, do you see this kind of this trend this year in the same being applicable to targeting healthcare professionals as well, sort of slightly outside of the consumer facing marketing?
Yeah, I mean, I think the move more to how we target. So in the US specifically, obviously, where we can do DTC advertising to healthcare professionals, we do. So actually, we've extended exactly the same approach, where we have an in-house programmatic team applying the same tools and techniques to healthcare professionals. Outside of the US, it's a different approach, but it's increasingly virtual communication and detailing. And I think one of the things which is obviously a huge potential shift for pharma is how we approach Congress. So in the past, we used to joke that the media budget we had in consumer was the same as the Congress budget we had in pharma. We were spending hundreds of millions of euros on it. But that has very much change now. So, we have to make sure that, we do still go to Congress, but it's much more considered about when we go, how we engage, the technology that we use, because, as someone that used to negotiate the deals for the Congress, it felt like a bit of an arms race. That we were, we need to have a bigger stand, we need to have the latest gimmick, when actually we're here to deliver scientific information and nothing more, really.
Absolutely. I think there's a term we're using a lot at the moment, which is science over scale, which is specifically related to targeting Congress, because I think there's loads of opportunity there around, and it does actually, there is convergence there with what Philip was talking about around kind of the creative approach, because I think the likes of things like attention metrics and engagement with content and content syndication is so much more available now, that even where you're targeting a hyper local, even geographically hyper local target audience, making that the creative scientifically accurate and not so reliant on scale now, and ultimately those new kind of those new measurements techniques that are coming through. I think that's really, really important. So in terms of the sort of themes and the trends that are in the industry, I think we've kind of touched on a few there. For this year specifically, are there any others that you envisage? I mean, I know things like AI across the spectrum in all sorts of different applications is becoming more prevalent. Have you guys had any recent experience of the use of that, and any kind of success stories that you could share?
I mean, we use probably not fully fledged AI. I think I've probably read as much as you have about ChatGPT and how that's going to basically take everybody's jobs in the next couple of years. We do work on bots. We use RPAs to automate certain tasks in processes. I wouldn't say that we're necessarily that advanced at this stage. I think just quickly going back to some of the trends, I would say, and this is interesting because it spans the two businesses that we're talking about in terms of pharma and OTC, is this trend towards self-care. So, one of the things that's certainly been a learning for many people is, actually, if you're sick, the last place you want to go is hospital right now. So actually the increase in self-care, the sales, as Philip alluded to, some of our immunity and nutritional products has really spiked, especially in China in the last 4 to 6 weeks, since they've reduced their restrictions. So it's interesting, and obviously that helps this unique position that we have in both sectors. So we try and collaborate between the two.
Right, that's really interesting. Adam, I don't know whether you want to come in at this point, perhaps.
Well, I was just going to jump in because I know, Philip, you were over at CES recently, so you're posting on LinkedIn about it. So I was just keen, talking about ideas, innovation, and obviously, new learnings and things. What did you take from there? Was there anything that stood out to you that you thought you could pull back and implement, or would want to share?
Yeah, I mean, I have to say it was the first time for me at CES, so it was quite an experience, as you would imagine. And I'd say I was generally impressed how dominant health and digital health solutions were present. I mean, of course, I read up on it and I expected some of it, but I didn't expect an entire, section of the convention, literally hundreds of exhibitors, focusing on health. It was just not something I expected. I have heard from people that it was actually even less than before, but you could see that health and wellness and digital health solutions and health tech is huge, right? And it's a clear space where founders and investors see a future, and that's maybe not surprising, especially coming out of the pandemic. Maybe most dominant were diagnostics tools and remote patient monitoring tools. So I think that was quite interesting, and sometimes really in a smart way. So you had so-called smart bathrooms, so tools which where you can measure your urine, and then there's an outlet on a smart mirror which showcases to you the results and what you can do with it, and then the mirror analyzes your skin health. And so I mean these were quite sophisticated products already. So I think that's something where I think the future goes. People are, I think, more more concerned about their well-being, as Malik said. There's a maybe also a drive to be more proactive and avoid just treating illness when it's maybe too late. But then of course tools have to, or products and these innovations, they have to be robust. They have to be simple. They have to integrate maybe with other tools and variables we already have. Because also we don't want to, again, like to the point, like there can also be too much data, right? It needs to be helpful data. It needs to integrate into my all-day life, and they need to be affordable, right? So I think that's maybe then where the future has to prove that these are not just gadgets. I think some are already beyond that gadget stage. But again, I think maybe it's still a bit too early to say, okay, how it will play out. But that was quite impressive.
Yeah, it's sort of carrying on from the self-help that Malik was talking about, and that trend. I suppose that maybe Bayer needs to play a different role in people's lives if they're taking care of themselves, and their relationship with their GPs and things is changing. So it's like, obviously I imagine there's quite a high element of risk associated if decision making is put at the hands of patients, right?
We need to help, and that's why and that's why we need to help patients, right? And we need to help people with that. So we need to almost like curate some of this and say, there's lots of things out there, and we as we can be a partner, right? We can be a companion in that way, and help making actually sense of some of the data you're getting. And that's why, for example, I work closely now with R&D and my colleague who is responsible for digital products, and he is very much focused on, we call it beyond the pill, that we come up with innovations which go beyond our conventional physical products, right? And provide solutions which help patients and healthcare professionals and anyone to be proactive and to look after themselves. And I can tell you, it's such an exciting place that for example, we're working with the company who provides a similar solution to McLaren Racing, the Formula One team, right? So that's something which maybe a few years ago would have not been even remotely possible. And now we actually collaborate with the tech partner of McLaren, and there is a link, there is common ground, and that's exciting to explore.
Cool. Chris, did you have anything more on the tech side? Campaigns.
No, I think there's some really interesting stuff there. Like, I guess that's to some degree there. What you're saying, Philip, is that that initial problem that Malik mentioned about kind of there needing to be there's a little bit more pressure on needing to find more efficiencies in the business, and that kind of, as we said, sort of cascading down to the way in which the marketing function and its partners operate. Are you seeing that from what you saw there, these partnerships that you're identifying and that you're seeing through AI? I guess just to cover off that point, are you already experiencing those efficiencies in your team and what you're doing from those new partnerships and AI? Is it already coming to fruition?
I think when it comes to the efficiency, I would say when it comes to efficiencies, it's maybe more for me about the ways of working, right? Yeah. And making choices and doing what we do less, and then we scale it. I think that's maybe something what we as an organization have to get better at. We are a very decentralized organization, and in our industry that's quite common, because regulations and other things. And we, I think, have to focus on, when it comes to efficiency, really scaling what we do well in one place and scaling this across. and not basically reinvent the wheel everywhere.
Yes.
With a similar approach, because that's really wasting resource.
Yeah.
But that's a tricky one, right? That's a tricky one for us. I guess that's a tricky one for this industry, and that comes down to, but then, that's organization, that's capability, and I think we are making good progress. But of course, there's a long way to go.
That's a really neat segue, I think, probably too, because I think the second kind of section of the session today, we kind of wanted to focus on the relationships that you have with partners and agencies that you work with, and obviously a sort of efficient operating structure and operating model between you and your partners will ideally enable a lot of that to happen, right? So perhaps Adam, over to you to lead that.
Yeah, cool. Yeah, thanks, Chris. Yeah, I was kind of just from, I know there's a lot of agencies on the call today, and obviously, Malik, you come from a marketing background, work with a lot of agencies, and Philip, you do now. I'm just thinking about, what are some of the sort of obstacles and objections that agencies should watch out for when they're targeting sort of big pharma? Do they make mistakes in terms of their approaches to you, and what sort of wouldn't go down too well in your eyes?
You go ahead, Malik. You go ahead.
Okay. So from my memory, so for me, the single most important thing is relevance. Yeah, I mean, nobody likes getting a cold call or an approach out of the blue on LinkedIn, and often the response to that is always the same. So understanding, what it is that you could offer to a company, not having a generic broad brush approach, being targeted to either specific therapy areas, products, at points in the life cycle, with the offerings that you would say are your real core strength. Saying you can do everything across every therapy area is unlikely to be credible, to be very honest with you. So be as specific and relevant as you can. I would also say that, you should think about it, and we'll talk a bit about kind of procurement's role in this. Think about who you approach. Sometimes for some companies, procurement are exactly the right entry point. Sometimes we're not. And I don't want to start undermining my entire profession, but sometimes it makes more sense for you to leverage the contacts that you have within the marketing function, because one of the things which is a bit of a bugbear for me is, if a marketing director turns around to you and says, I'm not allowed to use you as an agency because procurement tells me, honestly, that's bullshit. It's always their decision. If they want to fight for you to be part of the roster or to work on their particular brand, they will fight for you, and we get used as a scapegoat. So there we go. I got that out. Let's move on.
Love the honesty. Philip, what were you going to say there?
Yeah, I mean, honestly, there's not much more to add. I agree with the cold call, and I was thinking about this, turn it into a hot conversation, right? Like not try to get to us in a different way. And I think we are, and me in my role as well, I focus on our big global partners. But I'm also tasked by my CMO to find the best possible talent out there, right? So I will always be interested to hear and see great talent. But of course, I can't respond to every LinkedIn approach. I can't respond to every cold call in an email, because then I wouldn't do anything else. So it needs to stand out. And I mean, of course, we are, for example, we are involved in various forums. I'm involved with WFA, for example, the World Federation of Advertisers. I'm involved with Alliance, with EFIs, some of these awards. And of course, if we see award-winning work from agencies, then we are interested, right? Because it is relevant. It's not, of course, everything, but if it's great work, and I was lucky enough to to help judging. I was judging the EFIs last year, but I was also helping my CMO to be part of the IPA Effectiveness Awards here in the UK. And I mean, that's outstanding work, right? So, and if we see something there, then we are interested, right? And then that's what I mean. Like, then it becomes not a cold call anymore. So I think that's that. And then, yeah, I mean, just as Malik said, be authentic, don't overpromise, and find maybe a niche, and find what maybe how you can stand out from the crowd. And if that's the case, then we'll definitely be interested.
And I think that there's an element of kind of matchmaking here, and I think it's really important that you understand who it is you're talking to in terms of their capabilities as well, and really accepting that you don't find the world's best marketeers working in pharma. Let's be very honest about it. They are working for Nike, Samsung, the other companies that have more cachet and attraction than some of the conditions that we're trying to improve on. Also, you'll see, so you've got a capability thing that you need to take into consideration. Also, capacity. Obviously, a lot of the big pharma have a tendency to work with the large holding companies. And because that brings with it a degree of integration and resourcing that isn't necessarily possible from a small independent agency. Doesn't mean that the small independent agency isn't absolutely the best at their particular craft, but we have broken, for want of a better word, small talented agencies because we don't have the ability to work with them in terms of how we're set up. So what I would encourage you to do, and what we do in the way that we now approach pitching, is kind of a diagnostic of so what do you want from a capacity capability point of view? What are you able to offer? And what's the right model that we need to work on? Because we've tried them all, and we've got the scars from the bad ones, and we've got the benefits from some of the good ones as well. So,
yeah, great. I think you answered that question about the small agencies there in there, which is good. I mean, any other? I mean, obviously you mentioned the work. I mean, were there any big campaigns, like media creative campaigns, that stood out to you in the last sort of 12 months? Things that really caught your eye?
So you won't like the answer because it was an in-house, but it was the one that I remember most is actually the greatest that Apple did, I think, for the Persons with Disabilities Day in November last year. I love that work.
I'll have to share that one around. Philip,
yeah, you know what? I thought of the same, but of course I was lucky enough to be in Cannes last year, and I saw a lot of great work. Especially also in health and wellness. So it's really difficult. It's difficult to point or to pull one out maybe. But what was I can maybe talk a little bit about what resonated in Cannes. What was maybe one of the big themes in Cannes last year. And what I think what was really a common ground for award-winning work was work which actually really substantially changes people's lives, and in some cases changes laws in countries. Right? I think that's something what maybe also showcases the power of our industry. Like people feel sometimes, we are, or from the outside, we are, or marketers are just, draw pretty pictures and make some nice movies. But you know what? There is work out there which literally changed laws. And maybe just to mention one, there was one, it's called the Day After Island. Can't remember the agency, but there was a law in Honduras which basically didn't allow for the day after pill or the after pill. And then an agency or a brand, I think it was a charity, I guess, they basically picked that up and said, okay, that's ridiculous. So what they did, they created this barge outside in the international waters, and then they got people out there to this barge, to take the pill in a safe environment. And believe it or not, the president of Honduras changed that law. Things like that. I feel like are just really great examples of what marketing can do, what creativity can do. And again, this, it doesn't need a lot of money to do that. It's literally the idea. And I think that's where agencies, and I think also in that case, that I don't think it was a big agency, right? That's something which you can do with small budget, for charity. Obviously, there wasn't big media money behind it, I guess. But it was, it hit the news, of course, and it was a successful campaign and won a Lion in Cannes. So absolutely fascinating.
Yeah, amazing. And as you said, effectiveness is kind of what's needed right now, more than anything. Chris, you obviously, I know you mentioned you've done some work within the pharma space, and you're obviously, you're not small, but you're an independent. It's smaller than like the likes of like IPG. How did you sort of get into pharma, or your kind of early learnings?
Well, luckily it doesn't start with me cold calling or sending out LinkedIn messages to the likes of Malik and Philip. I think for us it was there's a kind of number of things really. Years ago, I think it primarily came out of the fact that I think we created a real the Congress point that Malik made earlier, I think was probably the first area of kind of transferability in our capability, because we kind of really specialized in hyper targeted syndicated content, hyper localized messaging, a lot of the time in the kind of retail space. And we felt there was a lot of synergy, and naturally with these things, they build momentum once you've, done a good piece of work at one particular Congress, and then you build from there. And I think that then leads into kind of more recently. And again, I'm very reassured by what Philip and Malik have said, because we've really focused on trying to pull out that kind of core specialism as something that we do. But also, I think we talk a lot about outcomes and deliverables as a business. And I think historically, a lot of the time, pharma, healthcare as an industry has focused a lot, or demanded from agencies a lot of input, which ultimately I don't think is the most efficient way to work. A lot of the time we're looking at kind of cold, hard deliverables and outcomes that we deliver as part of these really very specific therapy-based or condition-based products that we offer, which from our point of view, it was initially, it was never really a kind of deliberate move, but it's kind of really gathered momentum, and it's become a real area of specialism for us. So that's kind of in a nutshell how it came about, really.
I guess that's super relevant part, right, of taking that skill set to understanding the need and the challenge of the industry and making that match.
Exactly. I think it makes it easier for stakeholders within pharma organizations to work with outcomes. If agencies can deliver outcomes that are aligned with strategic goals wherever they are in the business, then there's kind of there's immediately alignment there between the two companies. It's a much easier conversation to have, and you won't have instances like marketing saying it's all procurement's fault and we can't talk to you, because actually what the agency are then doing is delivering on the strategic objectives that they're tasked with anyway.
Yeah. Philip, Malik, just interested then in sort of the relationships you've currently got. Like, what are the review processes, with what you can share with us, look like, with the current agencies? I presume procurement are as much involved with that in marketing, or is that something you step away from?
So
you go ahead.
You go. No, this is your baby. You go.
No, I mean, and of course, we were working on the same team, so we had the pleasure to work on some of these together. I mean, I think so. For example, when it comes to pitches, maybe one thing I can share here in this forum, I'm not sure if people are aware of this, and I think we at Bayer are quite proud about that we actually do this, and that to that extent is we do alternative pitch methods. So we have tried with a few alternative pitch methods. And one of them is the so-called pitch in a day, or the workshop style pitch. I'm not sure if everybody is familiar here with this. Unfortunately, until this day, I'm amazed that not many clients adopt that. And again, for example, at Adidas, we didn't do it. And I came to Bayer, and then they've tried it on actually, I think, a big pharma brand. And then we pulled it over to OTC, and we did it for a fairly big review a few years ago. And basically how it works is the pitch process is basically compressed in a day. I mean, of course, it's a little bit more than that. There is more preparation, a little bit up front, and there's a bit of after. But what it actually means is you organize it in a way that you as a team, as a client team, meet a picked agency team. And we have done it. We went to the agency office, and the client team briefs the agency in the morning, and then you workshop. You workshop it. You workshop that brief. You can involve the client team to a certain extent. There's maybe a couple tissue sessions during the day, and then in the late afternoon, the agency presents back to you, and that's it. So I think that's just maybe a different way to pitch and to find a partner. And I think I love it. I think everybody, it was for us also, it was really a procurement driven initiative. I think we also at the time had some, marketeers who were not so sure about it, including our CMO, but she let us do it. And she was equally, amazed by the process. The agencies loved it, of course, because they could show off. They could, of course, save some money in the process and not had a stretched out, week-long or weeks-long, process. And I think it's really about finding the right partner, right? Having that chemistry, working with the talent, which will be on your account. These are the things which this process allows. Of course, it's not for a small, one-off project. But if you want to find a strategic partner for the future, it makes perfect sense. And I can say that, the agency we have picked in that process has really grown over the last few years as a partner. And therefore, I think it was just it's a great example of how you can maybe run different pitch processes and be successful.
Yeah. I mean, I think it's a great idea. I don't know why more brands are picking this up. With so many people complaining about the pitch process, this seems to me a very realistic scenario to put brands and agencies together.
And I think it's important that it's part of the overall process. Yeah. So to your point, Stuart. So the other stuff which and love about submitting rate cards, declaring conflicts of interest, all that kind of good stuff, we do ahead of time. So if you like, this is the pre-qualification to get to the opportunity to bring your best and brightest to participate in the workshop. But the failures and the faults with the old pitch process. I mean, we know when a brief lands 4 to 6 weeks ahead of the pitch, or maybe 2 weeks ahead of the pitch itself, the very smartest people at the agency will crack the idea pretty quickly. Then you'll put it into beautiful PowerPoint, and the most senior person for the agency will then come in and take credit for it. We're not really interested in that. We're actually interested in the capabilities of the people within the agency, and not to come up with these ideas in a vacuum. The point that Philip made about, you interact with the brand team during the day of the workshop, because that's as close as we can get to the reality of how it will work with the agency real life. And as Philip said, we did that when we brought in the new lead creative for consumer health. And it worked really, really well because they're still here. And that's the best indication I can give you that the process has worked and we have the right partner.
Yeah, that makes sense. So just last question then on the sort of operational side of things. I know I was reading about, I don't know if it was that agency you're talking about, in 2018 when you sort of worked with Oliver and you started working with them in sort of one region and with Bayer Consumer Health, and now that relationship is a sort of truly global one, cross-divisional. So I was just interested in sort of what you learned about the organization. You mentioned you were quite decentralized and sort of the makeup of your marketing teams, just trying to work out why that worked for you and what you learned as a result of that.
Yeah, that was an interesting one. Oliver's an interesting one. Actually, Malik and I, it's funny that, bring this up because Malik and I had a conversation about Oliver way before. And we felt maybe, it wasn't the right time for us to start. But what happened then was, someone in our team in Asia Pacific was really convinced about them in the model. We felt that model is relevant for us in our organization, but maybe we were not yet at the maturity to work with them. But then it took a marketer in a region to really believe in it, and he then basically implemented that for his region, and for the requirements he had, and then we worked with them we started to work with them in APAC, And then, as it sometimes is in corporate organizations, I mean, people see a different model, a different approach. They're quite intrigued about it. Of course, it has proven to be successful. And then maybe also things then happen in other places. And so it basically was a bottom-up approach, right? So, then it basically went from one region to the next. And we started to work with them in the US. We started to work with them in EMEA. And we started now to work with them in Latin. But it's also important, in every region, it's a bit different. And now, of course, we have to find also a way to bring in maybe a little bit more of a global consistency into it. But I think it's a good example of maybe also here in agencies who have who are global partners. We have to recognize that there's not one size fits all, and let's say working with an agency in the US or in North America will be fundamentally different than to work with an agency in Asia Pacific. It's key.
I think it was also accelerated by what we saw in terms of the market trends. So I think that if the overall principle is doing more with less in terms of a content requirements, we saw in China and Asia Pacific, obviously they were the one of the earliest to adopt the approach on programmatic. And so we needed just vast quantities of content to be able to feed that. And having the Oliver model compared to a traditional, AOR model that we'd had previously was the right approach because the business needed it. And now we've seen that come further west to all the other regions and major markets. The expansion of Oliver has kind of tracked along with that.
Interesting. Chris, did you have anything you wanted to add there, in terms of sort of, tailoring a service, working, if you had to adapt your way of working to meet the needs like Malik and Philip are describing?
100%. I think there was a theme there being, I think the term that Philip used was, it's not one size fits all, and I don't think it ever can be. I think the best agencies are never delivering a service in that way. I think there has to be a modular element built in to however we deliver that. I think that's more complex now than it has been in terms of, there's capability is one thing, and how you utilize that capability, how you price that capability into products that are going to deliver the outcomes I talked about. But then there's also the operating model. So, we're working in areas where we're delivering a product and an outcome to healthcare and pharma clients, but actually we're flexing lots of those different capabilities in an in-house shared or fully managed solution, depending on whatever aligns with that particular objective and that client's own kind of internal structure. So like a good example would be, to Malik's point, it's quite consistent now to have in-house programmatic teams, and there is rightfully kind of an ambition to own the data, but the visualization, the warehousing, the utilization of that data within the context of kind of production, dynamic production, or performance marketing, or even brand marketing, there's often that's where the agencies can kind of really come in and help drive that. And so that's what I just think being kind of really the one size fits all phrase is spot on, because I think it's all about framing what the capability is around what's going to deliver the outcome in the fastest, smartest, most efficient way possible. That's what agencies are best at.
Yeah, makes sense. Okay, cool. So we've got 10 minutes left. I wanted to I think we're going to jump into a bit of procurement conversation. And I'm always interested by this because, I think procurement always gets a bad rep, right? And I know you guys are battling from your side. I've always been battling from my side. And I think you play a really important strategic role in all of this, right? Or at least should do. I know it's seen differently in different organizations, and that's probably what you're battling against as well. So Chris, you want to, I think you had a couple of questions to jump in on this, so I'll let you lead on those.
Yeah, I think probably a decent part to kick off is around the relationship element. I think it it probably used to be a tad easy when there used to be more reliance on in-person situations and meeting opportunities and networking. And I think now we've got a much more kind of blended model, really. Is there any kind of any suggestions that you'd have, Malik, for what agencies can do better to build that relationship and build that rapport?
So I would say probably the most important thing before you start is to figure out whether it's worth developing a relationship with procurement. And what I mean by that is, obviously, while we have good marketeers and less good marketeers, while there are fantastic agencies and some which are not quite so good, it's exactly the same within the procurement profession. So what I would encourage you to do, again, without undermining procurement, is figure out how good the person is that's opposite you, that you're discussing with or negotiating with. There's some very simple things that you can look at to help you determine that. When are you introduced to the procurement contact? Yeah, are you introduced at the very beginning as you're developing the brief for a new piece of work, so they're an integral part of the team? That tells you there's a strong relationship between marketing and procurement. Or are they parachuted in at the very end after the decision is made and say I'm here to take 20% off your rates and to sign you to 150-day payment terms? That tells you the relationship between marketing and procurement is a little different. Also, ask questions and offer guidance to your procurement counterpart about the work. Yeah, I mean, the more that we know about what it is that we're buying, negotiating, and working on, the better we are. Yeah. Now, and even sometimes that may involve sharing details around, pricing transparency you may not be fully comfortable with. But if you're working with someone who is very progressive and wants the best outcome, that will work in your favor. So I would urge you to try and find out, identify the hooligan element within procurement, because there are still some of us around, and don't bother. Go around them would honestly be my recommendation. But if you find people who are willing to learn and to engage on these topics, they will help you. Yeah, because they can help to fill some of the gaps that our marketing colleagues maybe can't do quite so well.
Okay, that's really interesting. Thank you. Yeah, I think it was particularly the point around the dynamics between marketing and procurement. It's a really good example of that. And how about, I guess, sort of looking to kind of, because I'm really conscious of time, to kind of group some common themes together that often feature, and I'm not sure agencies always get right. And in fairness, a lot of the time, the requirements can be different or inconsistent. But what about how can agencies better demonstrate? I think if we focus on ESG, DE&I, and sustainability as kind of the three most common themes there, perhaps give us, Malik, from your point of view, are there kind of 2 or 3 things that agencies could do better to demonstrate that, or those things?
So I think, again, it probably comes back to the point around relevance where we started. Is actually, Bayer, as an example, we have an enormous sustainability report, very clear ambitions that we've set across all the elements that you described by 2030 and towards net zero at 2050. Align your offering to be relevant to that. Yeah, at our heart, obviously, we're talking about pharma and OTC here, but the largest area we need to address is in agriculture. Yeah, so tailor your approach. I think for agencies specifically, carbon footprint, carbon neutral media offerings are interesting, but diversity and inclusion is probably the area that is most important for us, because we understand the power of diversity. And if we're looking for more creativity, as Philip said, that's probably where I would start.
And just as an example, one of our agencies actually have started a highly diverse, or let's say diverse first production company, right? So they really said, what, we realize, diversity in production is not, it's just too low, and they built a production company which had that at the forefront of it, right? So, and of course that shows then to us, okay, these guys are serious, and it therefore can really benefit us as a client, and in a way which maybe other agencies can't do it. So I understand that everybody can do that, but that's the thinking, what we're looking for.
Yeah, I guess I mean, it seems obvious, doesn't it, really? But I guess agencies sort of walking the walk and showing demonstrable evidence of them acting aside from just, yeah.
And by the way, this agency I'm talking about is not a holding company agency. It's it's a privately owned independent agency. So it's not something which you can only do if you are WPP or.
Yes, absolutely. Okay, well, there's some I think that's probably covering off my points there. Adam, did you have anything to add on this section?
No, I think that's all good. I mean, one thing I did want to apologise for is the lack of diversity on the panel, right? Because I think this has to be pointed out, right? And it wasn't by design, it wasn't intentional. We were meant to have Bethan on here as well, right? And it's never something we normally do on these calls. But if people were thinking and feeling that, I think it does need to be pointed out. I mean, talking of which, Patricia Corsi, you mentioned her earlier. She's your CMO. Shortlisted for, like, I think WFA Global Marketer of the Year. You sort of said she stood out to you. What is it? What's so special about her?
Yeah, and it's actually a shame that this call is today because the deadline was last night. So if you would have had that call yesterday, you could have all still voted. So we need to think about the time. As I said, I mean, she's a super inspirational leader. She's she has come into this industry also from, of course, FMCG. She's in the pharma marketer. She spent most of her career in Unilever and then went to Heineken. And I think her ambition was to really, help changing this industry. Help changing not only Bayer as an organization, and impact people's lives, but to be at the forefront of changing this industry. And this is an inspirational, place to be. And for me now. And she, of course, she brought me over from procurement. She said, I need someone like you to help me elevating our partnerships. And, I mean, you can't resist that. And it was the best decision of my career to do this role and to build this role and to work with her. And therefore, yeah, I think, if you ever have the chance to work with her, work with us, you will see it firsthand. I mean, she's just a great leader and a great marketer.
Well, no, it's good to end on that high note, but look, I think it's been a really incredible conversation. So much we could have got into. Just a big thank you to to Philip, to Malik, and obviously to Chris as well. Great insight. That's it from us. I mean, next month, as I said, we're joined by Publicis. We're talking to Distillery about the transferable skills between client servicing and business development. We've got a great workshop coming up with Catherine Strachan on CEO of Copy House about building your personal brand on LinkedIn. That's on 22nd of Feb in London. And yeah, if you want to sign up to more BD Matters things, it is a paid membership. We've got a free, a great offer on until the end of February, which is £250 for the year. And hopefully we'll see you on more of these calls. We've got Fidelity Investment. We've got Adidas lined up later on in the year. So yeah, it should be some more really interesting conversations. But thank you all, and we'll see you all soon.